Good morning, everyone. This is the Insurance and Real Estate Committee meeting that is being convened here on Tuesday, March 22nd. Should I start over, Alex?
You could go ahead.
Okay, great. We're convening the Insurance and Real Estate Committee meeting on Tuesday, March 22nd. My name is Carrie Wood, State Rep from the 29th District, and I am co-chair. Number 2 on the agenda is remarks from the chairs, so I want to pass it over to my co-chair, Senator Lesser.
Thank you, Madam Chair. Madam Chair, we've got a number of bills on the agenda. I know it's not everything that people have asked for, but it does reflect bills from all 4 legislative caucuses, and it reflects a very ambitious agenda. So I just want to thank the members of the committee leaders, our staff, including our nonpartisan staff, as well as our clerk and assistant clerks for all their work. And we have a lot of work going forward. Some of the bills on the agenda today are going to be near final form, but I think many of them are still works in progress. And so it's our hope for those bills that we're going to be able to work with the members in all 4 caucuses to reach as much as a consensus as possible. So I'll reserve the balance of my remarks for any specific bills, but I just want to thank you, Madam Chair, for your work and your collaboration on many of these, and hope we can move forward. At this point, I think this is the last meeting we currently have scheduled, although there is the possibility as well of having a meeting on our JF deadline on Thursday. And thank you, Madam Chair. Madam Chair, you're muted currently.
Oh, sorry. Representative Pavlak-D'Amato. Any comments?
Thank you, Madam Chair. Just the standard language or statements that are usually made, just to remind the public that, in order to keep on working on these bills, that we do have to vote it out of committee today, otherwise they die. So I know a lot of us have been busy with the short session, and even more reduced time than a regular short session. So a lot of the language has not been perfected, and I know we want to put in more effort going forward on a lot of these bills. So again, I might support the bill, not be thrilled with the current language, but we still have a lot of work to do. But I do want to thank the other members and the chairs. Matt, I know we apologize we didn't get a chance to talk today, but for everybody's hard work on this agenda and on these bills. So thank you.
Okay, so Senator Wong is, I think, there as well. Hello, Senator. Next up on the agenda, number 3, bills for review. Number 1 is SB 355, an act establishing the 340B Drug Pricing Non-Discrimination Act. Do I have a motion to JFS this to the floor?
So moved.
Moved by Senator Lesser.
Second.
Seconded by Senator Anwar. Any discussion? Representative Pavlak-D'Amato.
Thank you, Madam Chair. So this, I believe, am I correct? This does have JFS language?
It does have JFS language, and I would ask Senator Lesser to take us through the changes.
Yes, Madam Chair, thank you. And Representative, it's my understanding from this, the bill was brought to us by community health centers around the state, and their concern was that pharmaceutical companies had, in violation of federal law, unilaterally decided to stop participating in the 340B prescription drug discount program. This is a program that's existed for more than 2 decades, and is a vital lifeline for low-income consumers who access healthcare through federally qualified health centers. The initial bill that we heard was specifically targeted at pharmacy benefit managers, requiring them to keep the program going and to pass along the discounts. The concern was that was going after the wrong industry. And so hearing from the health centers, we attempted to mirror pending California legislation that's really focused on the pharmaceutical manufacturers, who are, of course, the folks most at issue here, because they're the ones who pulled out of the program, and it just simply requires them to continue to current practice, which is to pass on the discounts that federal law requires them to participating contract pharmacies that work with federally qualified health centers. I hope that answers your question, Representative, through you, Madam Chair.
Yes, it does. Thank you for that explanation. I know we, as a caucus, the Republican caucus, and Democrats as well, last time, our last meeting, we did take a stand and vote on some legislation or bill in progress, just because I know we feel that we've had a difficult time getting people to the table, and everybody to the table. This though, so this involves will this affect then only the drugs in regard to the qualified health centers, or what about just a regular individual who has insurance through their employer as well? What affect them as well?
Senator Lesser?
Yes, thank you, Madam Chair. And through you, my understanding is the bill would only apply to people who are accessing through one of the a contract pharmacy that is eligible for the 340B discount program. So we heard specifically, we raised the bill at the request of the health centers. I believe as well you may be able to access the 340B discount if you access healthcare through a safety net hospital or a family planning clinic. But no, if you are not receiving care through a safety net hospital, a family planning clinic, or a FQHC, I don't believe you can access the discount.
And I remember some of the testimony on this bill. And so let's say the savings is passed on to, and this is, I think, where I have some concern or some confusion. The savings that would be passed on to the qualified health centers, there might have been some different or confusing testimony to me, but would they pass that savings then along to other people who are trying to get medication, or to a specific pool or account that has to do with medication, or are they taking that savings and spreading it throughout the center for other things? I don't know, for salaries or for like structural improvements. Do we know that answer?
Madam Chair, can I answer that?
Senator Lesser, please.
Yes, thank you. And thank you through you to the honorable ranking member. What we heard was that this is a vital lifeline for low-income residents who are able to access the savings. But we also heard that some of the money is also, some of the savings are also recouped by the health centers, and that they use that to help fulfill the mission of their organizations. In our, I guess I'm not supposed to talk about caucus and what happens in caucus stays in caucus, but in a Democratic caucus prior to this meeting, the same issue came up. And what I told folks who had the same question that you did, Representative, was that, look, I think it would be important for Congress to look at funding of federally qualified health centers, and take another look at the 340B program and figure out if there are better ways to structure the program to make sure that savings really do go to consumers, and that we find robust ways of funding our health centers. But what is happening right now, which is just a unilateral and flagrant disregard for existing federal law, is leaving the most vulnerable people in the state, the people who access healthcare at our health centers in every town in the state, in the lurch. And if the drug industry has a dispute with our health centers about this discount program, they should bring that concern to Congress. But we are looking at lots of people, including people who rely on insulin to stay alive, who are losing access to low cost drugs. And, they should resolve this issue in Congress and get Congress to reform the program if that's their concern. But the way they're doing it right now is really just hurting the most vulnerable people in the state. And I think that's not a responsible way of addressing or reforming this program.
Okay. Okay, thank you for that answer. So you mentioned, so I'm kind of torn on this bill. Well, let me just say first, you had mentioned insulin, but insulin specifically, we did cap that copay, I believe, last year. And so that did pass the Senate as well. Is that correct? So that would apply in this case, right?
Madam Chair? Yeah, so the bill actually specifically referenced the 340B program because although the $25 cap that we passed in 2019 is really important, it really only applies to people who have insurance. And so people who access healthcare through federally qualified health centers mostly do not have insurance. And so the question is, what do they do? And what we found in our hearing was that at the time, the 340B program was how they were able to access. It was a great program to help uninsured people access affordable insulin. People were getting it for $5 or $10 a month, which was for many people affordable. But now that the drug industry is pulling out of the program, people are being stuck with, in some cases, thousands of dollars a month in bills. And if you're indigent in the state, that could be a death sentence. So, some of the drug companies do have sort of proprietary affordability programs, but charity programs, but they're hard to access. And so people who were getting $5, $10 a month insulin are now not able to get it, and that's a catastrophe. So that's where I first learned about this program in detail. But what's happened since then has been really heartbreaking and really concerning. Through you.
Thank you, and I agree with you. I remember hearing about the programs that certain companies would have, and I told them that I've never met anybody who has been able to access it or take advantage of the programs they have within their own companies for the public. And I just, found that a little strange. And I noticed that they did make an effort to put on some programs, I believe it was, or informational programs for us as legislators to pass on. But then that died out and stopped. They had one and never rescheduled. But anyways, I just want to move on to, you had mentioned the violation of federal law, and that's where my concern is. There are parts of this bill that I like, but I believe there is current litigation in a couple states. I believe Maine was one where they might have withdrawn or overturned it, and then one other state, I think Arkansas. Do you know anything about that? If a similar bill is in litigation, and if we would be subject to litigation as well if we pass this?
Madam Chair, can I? Yeah, thank you. Yes, through you, Madam Chair. I'm not familiar with the Maine litigation. I am with the Arkansas, the Arkansas litigation that the representative referenced. What I can say is that I've personally had some conversations with the Attorney General's office about how to structure this bill to make sure that we are able to survive a legal challenge. Certainly, that is a concern. And what I would say is that the S language before us is not modeled after the Arkansas bill because of exactly those concerns. And it's my hope that this language is structured in a way that is much more protected against any kind of legal challenge. I would lean on the expertise of the Attorney General's office going forward to make sure that final language, if this is not in fact the final version of the bill, it's in fact structured in a way that gives us the most reassurance that we're not preempted in any way or likely to fall afoul of a challenge that suggests that we might be. for you.
Okay, you've answered my questions. I do still have concerns about the because the involvement of federal law and preemption, and I do find that to be still a concern. You know, as I know all discussed in the past, that this is really, I think, mainly a federal issue, and of course, we want to do what we can, and you know, we have been working on that as evident in our last meeting, but I think for that reason, just because of the federal level, I am going to be a no today, but it's not I would say not a hard no, because it is a bill I'm interested in, and I will be looking into further, and you know, that vote could change down the road. So thank you for your answers.
Thank you. Representative Nuccio.
Thank you, Madam Chair. I think I have a couple of, this is really weird. Hold on. I have a couple of questions regarding the language that's in the bill right now. I've been doing a lot of research on this one here, and where I'm really kind of focused in on is lines 46 through 48, where we're talking about the inability to be able to identify these claims to provider, to industry, to be able to classify them. And overall, I'm kind of on board with what Representative Pavlik-D'Amato was saying. I think this is something that we should definitely look at doing. I just have some concerns around the language, and I'd like to make sure we have language in here that's not going to put us into a litigation camp. And secondly, I would really like to talk to whomever it is around lines 46 through 48, having the ability to put a modifier on these claims from the perspective of being able to accumulate them and quantify them so that industry can negotiate rates and quantity adjustments is key, because these specific claims are priced differently than regular pharmaceutical claims. So the language that's in here currently makes it so there can't be any discrimination when it comes to reimbursement or reduced payment or anything like that. The federally qualified health centers don't have to worry about being paid less from a distribution perspective from industry, but having that modifier there to indicate these claims are from a 340B plan are really key to being able to quantify the amount of prescriptions that are going out under this program, what the quantities are, and being able to negotiate rates and quantities from an overall combined perspective, regardless of account. So if there was wiggle room in there to talk about eliminating lines 46 through 48 or allow modifier language on there, I could be leaned more towards a yes on this, and just really ensuring that the legislation that we have in front of us does not mirror Arkansas or any Maine, so we don't get into the spot where we are with like the HSA bill, where we've done something that's going to get us into trouble later. So I'm going back and forth on where I am on this bill right now. I would like to know, though, I believe if this is Senator Lesser's bill, would you be open to talking about 46 through 48, sir, to see if we can find some negotiation on that?
Senator Lesser.
Yes, thank you. And I think the answer, sorry, through you, Madam Chair, to Representative Nuccio, I think yes on both counts. First of all, this is the S language is substantially different from what we heard in hearing, and so I understand that it's important that we talk to all stakeholders about how to make this work. And I think you made some good points. And I would also say that I would just repeat what I said earlier. Absolutely, it's my commitment that we don't want to follow the specific language of Arkansas, because I think there are some specific concerns there. And I don't want to come back next year to have to do a fix. I want to make sure we do this right the first time and be be willing to work with you to find a way to do that. So you make a good point about getting that data and making sure that we can work with industry stakeholders to find a way to make this this a workable proposal.
I appreciate that, because I don't think it changes the body of the bill at all. It just there's strong language in there that assures that the modifier can't be used in any other way. So I think if we could sit down and work on that piece, I think I would probably be more in favor. So I appreciate that, sir.
Thank you.
Thank you.
Any other comments or questions?
I'm good. Thank you.
Can you please take the roll?
Okay, so for Senate Bill 355 LCO 3860, Senator Lesser,
Senator Lesser in the affirmative.
Representative Wood,
Representative Wood is a yes.
Senator Anwar,
Senator Anwar votes yes.
Representative Comey,
Representative Comey votes yes.
Senator Wong.
Senator Wong votes yes.
One more time, Senator, please.
Senator Wong votes yes.
Thank you. Representative Pavlak D'Amato,
Pavlak D'Amato votes no.
Senator Cabrera, Senator Maroney,
Senator Maroney votes yes.
Representative Dathan,
Representative Dathan votes yes.
Representative Delnicki,
Representative Delnicki votes no.
Representative Farrar, Representative Meskers, Representative Nuccio,
Representative Nuccio votes yes.
I'm sorry, Alex, Representative Meskers votes yes, if it's not too late.
thank you. Representative Perillo,
Representative Perillo votes yes.
Representative Paletta,
Representative Paletta votes yes.
Representative Riley,
Representative Riley votes yes.
Representative Rochelle,
Representative Rochelle votes yes.
one more time, Representative.
Representative Rochelle votes yes.
Okay, good.
Excellent. We are going to move on to number 2, SB 357, an act concerning co-pay accumulator programs in high deductible health plans. This provides a fix to a bill that we passed last year, which would make sure there are no tax implications for plans using high deductible health plans using health savings accounts. It is a JF to the floor. Do I have a motion?
So moved.
Moved by Senator Lesser, seconded
Second.
by Senator Anwar.
Second.
Discussion, Representative Pavlak D'Amato.
Thank you, Madam Chair. So I remember this bill on the floor of the House, and I believe the good representative next to me, we discussed some of the concerns that we had with this bill, and I can't remember now if the concerns were specifically tax related. Of course, that is what happened. So just to clarify and refresh my memory, this bill went into, when did the bill that we passed last year that we are fixing, when did that go into effect?
January 1st, 2022.
Okay, so and this one, so this one is somewhat retroactive. I see. So those policies, basically nobody's policies would be, or no taxpayer would be affected by the bill from last year that we passed due to this correction. Is that correct to say?
Correct. It would make sure it would be retroactive starting January 1st, 2022.
And so maybe if you could just explain as far as what the issue was with the health savings accounts, what the effect was with the prior one, and what exactly this fixes or how it fixes.
Health savings accounts is you can use to put money in tax deferred, and the copay accumulator program allowed certain savings to be passed through. We wanted to make sure those savings would not be looked at in a negative way by the IRS and cause people to pay additional taxes on that. So the fix of this language would make sure that there aren't any tax implications through the IRS.
Okay, thank you. And I appreciate that. And I want to thank the chairs for bringing this forward. There are no more questions. Thank you.
Thank you. Representative Meskers.
Yeah, I just wanted to highlight my strong support for this bill. I had the pleasure of traveling to a National Council of Insurance Legislators during the summer to a conference, and the IRS has updated and changed its guidance so that the tax threat of the bill has increased. So it's imperative to us that we make the changes so we can protect our constituents from a potential loss of the tax benefit on the HSA. So I've worked closely with the committee. I've worked with various members of the banking community and the insurance committee to make sure that we have this language. And I think going forward, I think we will need to work on similar language on any changes to insurance policy to protect the HSA accounts. So we'll have to use some notwithstanding language to be included in other future legislation. But on this, I fully support it. And I thank the chairs for their coordinated work and effort on this.
Thank you, Representative Meskers. Any other questions? Clerk, please take the roll.
Senate Bill 357 to JF to the floor. Senator Lesser.
Senator Lesser, aye.
One more time, Senator.
Senator Lesser, aye.
Thank you. Representative Wood.
Representative Wood is a yes.
One more time, Representative.
Representative Wood is a yes.
Thank you. Senator Anwar.
Senator Anwar votes yes.
Representative Comey.
Representative Comey votes yes.
Senator Wong.
Senator Huang votes yes.
Representative Pavlak D'Amato.
Pavlak D'Amato votes yes.
Senator Cabrera. Senator Maroney.
Senator Maroney votes yes.
Representative Dathan.
Representative Dathan votes yes.
Great. Representative Delnicki.
Representative Delnicki votes yes.
Representative Farrar. Representative Meskers.
Representative Meskers votes yes.
Representative Nuccio.
Representative Nuccio votes yes.
Representative Perillo.
Perillo votes yes.
Thank you. Representative Paletta.
Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
And Representative Rochelle.
Representative Rochelle votes yes.
One more time, Representative.
Representative Rochelle votes yes.
Great. Thank you.
Great. Next, we'll move on to number 3, SB 358, an act concerning required health insurance coverage for breast health benefits. This is a JFS to the floor. The JFS language includes additions of early detection for ovarian cancer. Do I have a motion to JFS this to the floor?
So moved.
Moved. Representative Dathan.
Moved by
Second.
Representative Dathan, seconded by Representative Rochelle. Any discussion? Representative Pavlak D'Amato.
Thank you, Madam Chair. I guess my initial question is you could start off with the difference between the JFS language and the original language submitted for you.
Sure. The JFS language includes early detection for ovarian cancer.
Then if you could also go through the other language of the bill, I guess, because we've worked, and I know I've worked with Senator Lesser in the past, worked on versions. So I guess I'm not sure what was passed or not passed in previous sessions. And so how this bill is different from the current language and what it does and adds.
Sure. The existing legislation allows for women or insured with dense breasts to get an ultrasound if there was an issue seen in the mammogram, and it would mean at no copay. There have been reports that women may also need a diagnostic test, which may be a breast MRI, an ultrasound, and other types of follow-up as a result of something that was seen in a mammogram. And this language would tighten that up to make sure those additional services would also be free, meaning no copay in order to get those tests done. It also covers certain breast biopsies, mastectomies, reconstruction as well. So that is all in this bill.
Okay, thank you. I think that, I don't think I realized that the reconstructive is probably something that we have not worked on in the past. So I did think that we had worked on the dense breast portion in the past. So do we not have anything existing that requires coverage for dense breast, or is it moving it to a different category?
We have coverage for mammograms, and then if there is something seen during the mammogram, we have coverage for ultrasounds. Ultrasounds are often not the only test that would need to be done when you have dense breast. It may be a breast MRI, it may be other diagnostic testing. And the intent of this bill is to close that loophole so that any sort of follow-up regarding something seen in a mammogram would also receive the same coverage as an ultrasound, which would be having full coverage plus no copay.
Okay, so this does not, what was the copay before? Was there an issue with copays existing that changed it to zero, changed it to none, or is it moving it to the diagnostic that takes care of that as well? I guess I just want to clarify.
I think the issue before was that, your copay would be determined by what type of plan you have. If you have if you're under the Affordable Care Act, you have the bronze, silver, or gold platinum plans. So this is to make sure that women have no hurdles when they have an issue that is noticed in a mammogram to not taking that next step as a follow-up. It's a bill that promotes early detection, which would, in the end, save our healthcare system money, save people money, and save lives, so that women and other, insured are not waiting until their late stage, cancer to do these follow-ups. So that is the intent of the bill. It's in early detection, and this would now include any ovarian, potential ovarian early detection as well.
And I see that the age has been dropped from 39 to 35. Is that correct?
That is correct. And the age was dependent on certain conditions like having a certain gene, or having had, I believe it was radiation of some sort, which would mean that you're much more likely to have an issue. So again, encouraging early detection at a younger age.
Okay, and just to clarify, I believe the bill generally allows for the additional coverage for 35 to 39. But if it's younger than 35, then they have to have one of those additional factors in lines 24 to 35. Is that correct?
That is correct.
Okay, and the change in age to 35, is that, I know the Cancer Society makes recommendations, and is that along the lines of what the U.S. Cancer Society suggests?
It is in line with data that is showing women are unfortunately being diagnosed at an earlier age for this type of cancer.
Okay, that's all the questions I have for now. I know there was just that one change with the JFS language, so I just want to thank everybody for their work on this bill. Thank you.
Representative Nuccio.
Thank you, Madam Chair. I just wanted to kind of express some frustration, I guess. The bill in its original form, I was absolutely supportive of, but just receiving JF language this late and adding reconstructive surgery and ovarian cancer to it, I'm supportive of exploring those things, but I don't feel like I've got nearly the information that I need to make a decision on that. There really wasn't a lot of public testimony around those two things. There weren't a lot of details given to us. There's no research to look at. There's no how this is impacted in how this is going to impact the rates or anything else. The original portion of this with the ultrasound and the dense breast, that's something that I've been trying to find a resolution to for a while. But unfortunately, with adding these other things in there, I don't feel like I have enough information to be able to vote on this in an educated manner. So if we had gotten it earlier and had a chance to sit down with people and talk about it, I think I could have probably gotten to the supportive aspect of it. But unfortunately, I just feel like I don't have enough information to vote yes on this one right now. So I'm sure it's going to pass, but I'm going to vote no right now so I can try to do some research and figure it out. And then if it comes to us on the floor, if it has different language or something that I can back it up, that's not anecdotal, but actually like data driven in that, maybe I can be swayed to reconsider my vote on the floor. Thank you.
Thank you, Representative Nuccio. And the only change to this is the addition of the ovarian cancer language. This is the same bill that was voted out of committee last year and also voted on the House floor. The addition to this is the ovarian cancer piece.
Was reconstructive surgery in it last time though? I don't recall reconstructive surgery being in it.
Yes, it was in it.
Okay. All right. I'll look back at my notes on that one. Thank you.
Representative Rochelle.
Thank you. And I just wanted to, express my strong support for this additional language and thank the committee for working with me on this. The National Organization for Cancer Research, the Ovarian Cancer Research Association was planning to testify. I will be getting some language from them, and I'm happy to work with any of my colleagues on this. The reality is that the same BRCA gene that causes breast cancer is responsible for 60% of increases your rate of ovarian cancer by 60%. So this is very much tied together, having the same origin of causing cancer in a lot of cases. And because ovarian cancer is actually more deadly than breast cancer is for women, which is something to keep in mind on why we're adding this in and why it's so closely related to each other. The origins are the same. The types of diagnostics are similar. You're looking at transvaginal ultrasounds versus breast ultrasounds. And the reality is that 80% of cases for ovarian cancer are not found until stage 3 or 4. And that's because there are very limited diagnostics available, and the ones that are available are not standard of care for people that have a known family history. So having folks that have a known family history or discover that they have the BRCA gene, making sure that they are able to have this surveillance is critical, because otherwise they're going to fall into that 80% that don't find it until it's too late. And so this will have a true impact for the people that do get ovarian or carry this gene in a way that is very similar to what we're doing for the breast cancer. And again, because the genetics are the same underlying, it is pretty directly related.
Thank you, Representative Rochelle. Senator Anwar.
Thank you, Madam Chair. I just wanted to amplify what Representative Rochelle has said. Actually, ovarian cancer is a silent killer. It is usually asymptomatic when it starts. It can be identified with blood tests, but needs radiologic tests to be able to identify it. And it's a matter of life and death. If it's identified early, a person is cured. And unfortunately, majority of them are so far along by the time they cause GI symptoms or intestinal symptoms, it is far more complex and complicated. And it is a silent killer. It is unfortunately very, very active in our communities. We've seen this in all of our communities, and I'm sure most of us would know one or two individuals within our own direct network which may have been impacted by this. So it's a good bill, it's worthy, and it's going to save lives. Thank you.
Thank you. Any other questions or comments? Clerk, please take the roll.
For Senate Bill 358, LCO number 3861 to JFS to the floor, Senator Lesser,
Senator Lesser, aye.
Representative Wood,
Representative Wood is a yes.
Senator Anwar,
Senator Anwar votes yes.
Representative Comey,
Representative Comey votes yes.
Senator Wong.
Wong votes yes.
One more time, Senator.
Wong votes yes.
Thank you. Representative Pavlak D'Amato,
Pavlak D'Amato votes yes.
Senator Cabrera, Senator Maroney,
Senator Maroney votes yes.
Representative Dathan.
Representative Dayton votes yes.
Thank you. Representative Delnicki,
Representative Delnicki votes yes.
Representative Farrar, Representative Meskers,
Representative Meskers votes yes.
Representative Nuccio,
Representative Nuccio, oh, holy moly, I don't even know my own name. Representative Nuccio votes no.
Representative Perillo,
Barilla votes yes.
Representative Paletta.
Paletta votes yes.
One more time, Representative.
Paletta votes yes.
Thank you. Representative Riley
Representative Riley votes yes.
and Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Item number 4, SB 363, Act concerning health insurance reimbursement parity for podiatrists. This bill is to have payment parity with podiatrists performing the same type of surgery as an orthopedist. The motion, do I have a motion to JF to the floor?
So moved, Senator Lesser.
Moved by Senator Lesser, second.
I'll second it.
Second by
Representative Comey.
Representative Comey. Any discussion? Representative Pavlak D'Amato.
Thank you, Madam Chair. Go over some of the, maybe just explain the bill a little more as far as what procedures the podiatrists are performing that they're not getting reimbursed or that they want to increase the reimbursement for. If you could just start with that.
Sure. I'm going to ask LCO. There's a reference to Public Act, and I was wondering if LCO is on, if they could walk us through the various, oops, where to go? If they could walk us through the various procedures that are referenced here in the Public Act.
For a sample, at least, just so I get a better understanding.
Connor or Patrick, are either of you on to give an example of the types of coding that's in the bill?
Sorry, Repwood. This is Connor from LCO. I was on mute. This is something I can take a look at. I can't talk about it at the moment, but I'm happy to get back to you.
Okay.
Alex
thank you.
Rieger, also, OLR. I may have misheard. Was this still podiatrists?
Yeah.
Okay, I have the raised bill. What's the question at hand? I may have misunderstood that.
The type of operation that we're talking about here, where payment parity would be applicable.
Okay, so it's actually anything within the scope of practice. The bill just specifically says that insurers can't pay a reduced amount solely because the practitioner is a podiatrist. So presumably this extends to anything within their scope of practice.
Now, I guess I'm also confused then of the understanding of the difference. I guess and maybe if the chair, somebody can help me, a podiatrist is not an MD doctor. So I was just wondering what the difference is or what they are considered for clarification.
Senator Lester, are you raising your hand to answer the question?
Yes, I can do that, or we can have OLR do it. My understanding is that through you, Madam Chair, that a podiatrist is completed a graduate program in podiatry. It's a post. It's a formal podiatry education, which is analogous to a medical degree, although it is not an MD program. It is a separate graduate program. It requires an intense field of study.
And this, I believe this bill references 38A-469. I'm just wondering what that exactly, I think that is definitions. If somebody could just give me an idea if that's correct. I think it's that.
Alex?
Pulling it up now.
So can you hear me now? Okay. That is our standard definition. So for most health insurance bills that involve a mandate, we only apply them to a certain qualification of health insurance. Generally, the ones that are referenced are the standard practice for things like basic hospital expenses, basic medical, surgical, things like that. It excludes certain ones that may not be might not immediately come to mind, such as policies that only cover a very specific disease, for example. It is standard boilerplate to apply these sort of mandates to the broader population of what most people consider quote unquote health insurance. And I can send you the specific list. We have those.
Okay, all right. Is there any, I guess, you know what, we're always looking at whether this would, although I know we just voted on a mandate, does this have the potential to increase rates for that 30% of the market that we're always concerned about for you?
It has that potential, yes.
And I do see that there was some testimony, and I know it was in the other, the last bill we did, and I haven't found it yet if it's this bill, but I believe we are currently looking at the effects of mandates. So I do have a concern as to how some of our bills that we're passing now out of committee, if they are ultimately passed, how it will affect that current study that I believe is already in the process, and is, I think, set to come out in next year, 2023. So I'm not sure if this would be included, or or anything we're passing this year would be included, or if it would be pushed off to the next study. So I will be a no vote today, but I will look a little further into this. Thank you, Madam Chair.
Thank you, Representative Comey.
I was just going to try to fill in some of the gaps that we were unable to fill in. I was just looking, I remember during our testimony, and I was looking at the written testimony that's on the site, and you know, some of the as far as the schooling, the education of the podiatrist, they have 4 years of undergraduate and 4 years of medical school. And then they take additional courses on the lower extremity. And then they do a 3-year residency program. So that was one of the questions I believe that we heard. And just as I remember when they were talking about, I remember them speaking about some of the procedures being about, you know, bunion surgery and some of the reconstructive bunion correction, as well as hammer toe corrections and other sort of procedures. And if I remember correctly, that they were being paid anywhere from 20% to 60% less for the same procedures than orthopedics. So on.
Thank you, Representative Comey. Representative Meskers.
Yes, thank you, Madam Chair. I'm very conflicted about the bill. I'm concerned that we're looking for payment parity, but if I'm trying to manage healthcare costs, what I'm not doing is mandating the lowest cost denominator in that payment parity and providing of service. So if my bills on payment parity with podiatrists and surgeons serves to increase the reimbursement rate, it's going to show up in premiums for the 30% of the medical insured pool in Connecticut, or the 30% that are covered by healthcare plans that we mandate on. So I'm conflicted, and I don't know how I can support a bill that's, the intent seems to be to raise the cost of healthcare versus to try to get to an equality in the payment of healthcare. And I don't think I'm arming my constituents and my premium payers with the right defense to try to control healthcare costs. So, you know, that I expect I'll vote no on the bill. I'm very conflicted on this.
Thank you, Representative Meskers. Representative Nuccio.
Thank you, Madam Chair. Wondering here if you can clarify for me again, the bill as it is says, and I think maybe OLR said this, that you cannot pay a podiatrist simply because they are a podiatrist lower for the same CPT code. Is that accurate?
That is correct. That is correct.
Okay, but if they have negotiated lower rates, or if the intensity of the procedure is different, there can be disparity in how it is paid, correct? We're not necessarily fixing a rate with this, because like Representative Mesker says, I do not believe that legislators should be deciding what the applicable payment rate is for a procedure, a medical procedure of which we have no understanding of. So it's just, I'm trying to wrap my head around of exactly what we're trying to do here, because as Representative Mesker said, you know, I don't think it's our place to say, if I pay you $10, I have to pay you $10, and I have to pay you $10, and I have to pay you $10. So I just want to make sure I'm understanding it correctly.
Yeah, I mean, the language is you can't pay less for the same service. So, I
But
don't think it's
but
about setting a rate.
is the key that, but at that point you are setting a rate because you're then tying somebody else's negotiation, their negotiated rate to somebody who didn't negotiate that rate. So you're setting the rate for a CPT code instead of setting it by a provider or through regular negotiations. So it definitely is setting a rate, but I want to kind of hone in on the language that I believe OLR said is that it's simply because they are a podiatrist. I guess that's where my concern or my consternation is. I'm trying to figure out that piece of it because I too, like Representative Maskers, are kind of on the fence here. Can OLR speak to that maybe?
Alex?
Yes, so if I understand, you would like confirmation that this is specific to not paying a provider less solely because they are a podiatrist, but the bill does not speak to other reasons why you might differ in pay. It only speaks to if it prohibits the only difference in paying being due to the provider or podiatrist. Is that the answer to the question?
That's funny. You're asking me for the answer.
I'm sorry, let me rephrase. Am I answering the appropriate question that you asked?
I think so.
The bill is silent for other reasons.
How would we determine that? If somebody comes back with a different negotiated rate, how would it be determined that it was solely because they are a podiatrist and not because of any other factors?
I think, is that to me?
Maybe, yes.
I think in general that the rate that is paid by insurers, and I'm uncomfortable getting to the specifics of insurer and provider contracts because, as you know, those can be incredibly complicated, would have a factor in for things like facility or education of provider, right? If it's APRN versus podiatrist versus orthopedist versus whatever. So presumably that sort of thing would be broken down in the contract, but I can't answer that with 100% certainty for you.
I appreciate that. So I guess that's where my concern is with this bill right now. We're broad stroking something that needs a lot more finite detail. And I don't know that what we have in front of us does that. And I don't know how we validate it. So we're passing legislation that I don't know that it's administrable. So I'm going to listen to see. I see Senator Lesser has his hand up. Maybe he'll have something that will quell my questions. Thank you, Madam Chair.
Thank you, Representative Nuccio. Senator Lesser. Maybe Senator Lesser, are you available? Okay. Any other comments or questions? I'm Representative Nuccio, do you have any more questions? I know you said you were hoping for more discussion, but.
Well, I guess I understand what this bill is trying to do, but I'm concerned that, again, we're broad stroking it. So I'm interested. I guess I would have to say I would have to vote no for now without understanding fully the impact of what this bill, how the nuances are going to work and how that's going to be determined. So I was hoping that Senator Lesser might have some more information on it since it's a Senate bill. Maybe he had to step away for an emergency or something. I'm happy to prattle on for a while to see until he pops back up on the screen if need be.
Representative Maskers.
Thank you, Chair. I am in the same conundrum here. In the interest of parity and healthcare costs, I would want to mandate that the provider seek the lowest common denominator in the payment for provision of services, not the highest common denominator. I'm concerned that this bill raises parity to the highest price paid for a service rendered versus the lowest price paid for a service rendered. I don't want people to get hammer toes or bunions or have bad outcomes in their life. And I don't mean it facetiously, but what I want is I want the best provided cost for the procedure. And therefore, I want to drive the cost structure to the best provision at the most reasonable price. And I'm concerned that this is going to drive the business towards specialists who are at some level overtrained or over experienced, and raising the cost level and therefore boosting my insurance premium. So in the absence of that intent, I think, parity in a competitive environment means that everyone gets the same price, but it looks like it's the highest common denominator, not the lowest common denominator in terms of that compensation. So it's problematic for me. So I expect I'll be voting no as well.
Thank you. Senator Lesser, are you available? Okay, any more discussion on this? Seeing none, clerk, please take the roll.
I see Senator Lesser's back.
If the vote's open, if the roll's open, that's fine. Just take the roll.
Sure. Okay, for Senate Bill 363 to JF to the floor, Senator Lesser.
Senator Lesser in the affirmative.
Representative Wood.
Representative Wood is a yes.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Representative Comey.
Representative Comey votes yes.
Senator Wong. Senator Wong.
He stepped out.
Representative Pavlak D'Amato.
Pavlak D'Amato votes no.
Senator Cabrera. But I saw him. Senator Maroney.
Senator Maroney votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative Delnicki.
Representative Delnicki votes yes.
Representative Farrar. Representative Meskers.
Representative Meskers votes no.
Representative Nuccio.
Sorry, I had to click all my buttons. Representative Nuccio votes no.
Representative Perillo. Representative Paletta.
Representative Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
And Representative Rochelle.
Representative Rochelle votes yes.
One more time, Representative.
Representative Rochelle votes yes.
Thank you.
Thank you. Next up, item number 5, SB 364, an act concerning health insurance. This is a bill to study health insurance. Do I have a motion to JF to the floor?
So move, Senator Lesser.
Moved by Senator Lesser. Second by Representative Meskers. Any discussion? Representative Pavlak D'Amato.
Thank you, ma'am. Just to clarify, would you consider this what we often refer to as a dummy bill?
I would never consider any bill a dummy bill. We are using this bill as a place to study health insurance.
Okay, that's a better explanation. I apologize. I appreciate that explanation. And I think it's a great bill, so I will be supporting it. Thank you.
No other discussion. Clerk, please take the roll.
Is Senate Bill 364 to JF to the floor, Senator Lesser.
Senator Lesser agrees that it's a great bill. Aye.
Representative Wood.
Representative Wood is a yes.
One more time, Representative.
Rep Wood is a yes.
Thank you. Senator Anwar.
Senator Anwar votes yes.
Representative Comey.
Representative Comey votes yes.
Senator Wong. Representative Pavlak D'Amato.
Pavlak D'Amato votes yes.
Senator Cabrera. Senator Maroney.
Senator Maroney votes yes.
Representative Dathan,
Representative Dayton votes yes.
Representative Delnicki,
Representative Delnicki votes yes.
Representative Farrar,
Representative Farrar votes yes.
Representative Meskers,
Representative Meskers votes yes.
Representative Nuccio,
Representative Nuccio votes yes.
Representative Perillo, Representative Paletta,
Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
Okay, and Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Item number 6, SB 377, an act concerning health insurance coverage for newborns. The current law is newborns in the hospital for 60 days would be do not have to apply for health insurance until that point, and would not have any costs borne to them. This 377 would extend that to 120 days or upon discharge. Do I have a motion to JF to the floor?
So moved.
Moved by Senator Lesser. Do we have a
Second,
second by Senator Anwar. Any discussion? Representative Pavlik Tomato.
Thank you, Madam Chair. So, let me just. Thank you, Madam Chair. So, I just wanted to go through some of the parts of the bill. If you could explain, or I'm not sure if you're handing it off to the proponent of the bill or another individual, just a little bit of background of what this bill is and what the changes are in this.
Sure.
Yes, thank you, Madam Chair, and through you to the honorable ranking member. Currently, you have, after giving birth, you have 60 days to enroll a child on your health insurance if you're an insured individual. And there's a 60-day grace period where if you go within that window, the insurance will retroactively cover the child from birth. The bill before us would extend that to whenever you actually leave the hospital, because in some cases, we heard in testimony from the Connecticut Children's Medical Center that people are in the hospital, sadly, for more than 60 days if there's a particularly complicated birth, or 120 days. And so the idea would be to extend that grace period. Again, it would not add coverage to anybody who's not otherwise who's not already eligible, but it gives a grace period for people to actually go through the process of enrolling a child on the health insurance that they're already entitled to. I think what we, just in terms of a quick explanation about why this is needed, the concern, and there's been reporting about this around the country and including in Connecticut, is that in some cases, a parent inadvertently does not go through the process within that grace period of enrolling their child on their health insurance, and then they get stuck with a massive surprise bill that they would not otherwise have been stuck with simply because they did not enroll their kid within the allotted time frame. And this is intended to protect someone from a surprise bill.
Thank you. And now there is language, though, I'm looking at around existing language around line 22 that states, in order to continue coverage beyond such period of, that's, what we're possibly changing, provided failure to furnish such notice or pay such premium or fee shall not prejudice any claim originating within that period, whatever the date may be. So I guess just based on what you just said, if somebody does not sign them up and they're past that 60-day window, then what currently happens? Are they able to go back and add them on to such claim, or what is, or then the person just would be stuck with the bill, or what is happening?
Yeah, so they think, Madam Chair, may I answer?
Please, thank you, Senator.
Yes, thank you. So through you to the honorable representative, my understanding is that a person could at 61 days under present law enroll their kid on their health insurance, but the issue, it would no longer be retroactive. So, you know, if you can imagine how much a 60-day hospital bill could be for a child born prematurely or with a major health complication, it could easily be millions of dollars. And so the insurance would no longer at that point be required to pay for anything prior to the first 60, for the first 60 days. So, the parents in that case, even though they had insurance and their child would normally be eligible for it, could be stuck with a multi-million-dollar surprise medical bill, which, would be tragic on top of what's already a very difficult situation because they're going through a major medical issue. For you.
Okay, so then at that point, let's say, would be, my question is it the hospital then that would be eating those costs? And for you,
Senator Lesser.
It's a good question, right? So, if you don't have millions of dollars and the hospital they're not getting reimbursed, I assume they're going to do everything they can to try to collect from the family. But if the family does not have the resources to pay the multi-million-dollar, in this particular instance, surprise medical bill, it could be financially ruinous to the family. But you're right, the hospital could also wind up eating a big chunk of the cost, which is probably why Connecticut Children's Medical Center, and I think last year we heard from a number of hospitals, also want to make sure that, that this paperwork issue isn't something that precludes access to coverage.
thank you. And I agree. Of course, I do have concerns that, as we now have seen, and I know there was testimony, I'm not sure if it was this bill or another one, about the closure of the birthing unit in Wyndham. I know in Bristol we have a community hospital, and if something like this were to, I'm looking at the language of the bill, or date of discharge from the hospital, whichever is later. So let's say that's a year down the road, they're housing someone for a year without any insurance coverage. The person just decides they don't want to sign up. What that could do potentially to that hospital, and then of course the services it provides to everybody else. So there isn't anything currently that would require somebody to, let's say in that period of time within that year, to sign up for any type of insurance coverage. Is there through you?
So if, Madam Chair, may I respond?
Please.
Yeah, so through you, if a child were born with, a massively complicated medical issue that required a year's hospitalization, yes, this bill, if it passed, would say that the parents would not have to notify the insurance until the date of discharge, which could be a year. I think my hope is that if that happens, it's a vanishingly small number of cases. But what I've seen in press accounts, for example, is that parents who are traumatized by terribly bad outcome, and the last thing they have on their mind is going to their own corporate HR to get their child added to their health insurance. And obviously, in the vast majority of cases, this happens. But in the rare cases where it doesn't happen, we want to make sure that people aren't stuck with that surprise bill.
Well, thank you. And I again, I'll go back to my point that even let's say whether it's one or a couple, I think that there's potentially here even one case of something like this, if it did last a year, and probably not even when you think of the cost that this could put an entire hospital under. And that's really concerning to me. And let's say if not the hospital, the unit. I mean, I don't see that. I don't see why a hospital would continue to have a birthing unit in their hospital after this. And I think more and more would just choose not to have to deal with it. And, you know, then we're again creating the problem that I know a lot of people testified against in various hearings about the lack of accessibility for people in that area of Wyndham. Now, you did, I think the senator brought up, you do bring up great points, and I have to say that whether there's an issue or not, I think the whole, you know, as somebody who gave birth recently, the whole process is, I don't want to say traumatizing, although I'm traumatized, but it's overwhelming, I'll say. And yes, I agree that nobody is necessarily thinking about their insurance coverage at that point. Or, you know, I think in talking with some other individuals, you're possibly thinking, or I'm trying to think at the time, I definitely didn't think about my insurance coverage, but almost assumed that because I was going to prenatal appointments that the coverage would just continue. And I can, looking back, of course, I can understand why it wouldn't necessarily, you know, I could have had 2 kids and so forth. And so, yeah, you know, you have to get the social security number, a whole bunch of things that have to occur while you're sitting in a hospital bed and trying to take care of a newborn, trying to take care of yourself. And, you know, I do remember, I'll say that there were different individuals that went, and I love my hospital, by the way, but different individuals from the state, from the hospital, to talk about different programs, whether it was breastfeeding. I remember getting a whole stack of forms that I had to fill out for the state about information about me, about my family, and a bunch of different questions. I don't ever remember getting anything telling me that I had to and should sign up for health insurance and do it within a certain period of time. Now, I'm not sure who was here at the time, but this bill, we have 61 days currently due to one of our fellow House members, Rosa Rebimbis, who I believe the original number was 30, and she years ago got that extended to 60. And so that's why we have that today. And of course, again, if you don't know what the 60 number is, you're not thinking, oh, I should take care of that pretty soon. So I think there might be some alternatives to achieving somewhat of a solution or better solution for the issue. And, you know, one of them is really just making the parents aware of what that time limit is. And so, Madam Chair, I do have an amendment that I would like to bring forward, and if you would let me read that, if you're so inclined to do so.
Please proceed.
Thank you. So my amendment strikes after the enactment clause, the new portions of the bill before us. And what it states that is, if a child is born in a hospital in this state, the hospital in which the child is born shall not later than the time that such child is discharged from provide a written notice to each of the child's parents or legal guardians disclosing the requirements established in C of 38A-490 of the general statutes as amended by this act, and subsection C of section 38A-516 of the general statutes as amended by this act. And so this bill it does exactly what I think I would have liked to receive, and what I think would be very helpful to many people to just know that that there's, you know, you do have to sign up your child, that you have 60 days to do it, and even, you know, a single page notice, or although I think the way I explained it before is there's a few things I would have liked to just have pictures on, because after giving birth, you're a little out of it for the next couple days, and you have a lot going on. So anything to make that process and put parents or guardians on notice that, by the way, you do have to do this. Don't forget. Because again, I got those sheets of a ton of other things to do, to fill out, and this would have been very helpful at this time. So I would like to make this motion to amend the bill to add this portion, Madam Chair. And I ask for the vote to be taken by.
Thank you. We have an amendment. Do we have a second?
I'll second that.
Second by Tammy Nuccio, and we can open it up for discussion. I had my hand raised, so I'm calling on myself. My question to you, Madam Ranking Member, is how would this work if we have jurisdiction over the fully insured market here? Would the hospital need to know what type of insurance they have, or would this apply? And again, I just don't know logistically, would this apply to every person that's having a baby?
Just like the other forms that I got, I think a general notice telling people that, hey, if you have insurance, right, that, remember, this is the time frame in which you need to do it. I know that we have talked about in other areas of insurance and HSAs, just getting the information right in front of people. You sign up for this high deductible plan, hey, you should know about this HSA. And this is the same thing. It's a general notice saying, okay, if you have insurance, don't forget that this timeline applies under state statute, because I say that I think even after I had my child, I had difficulty even finding the statute to try to look at and see how long do I have to do this, and tried to look through the information that I had from my plan initially, couldn't find it, and called and didn't get anywhere. So just one of these general reminders that are with everything else. So if it doesn't apply, it doesn't apply. I think signing somebody up for insurance would be another option as well, which I know there are places or parts of hospitals and organizations that will try to do that. So this, again, just a general notice saying, don't forget, and by the way, here's your timeline.
Thank you. I will move on to Senator Lesser.
Thank you, Madam Chair. And through you, I just have a few questions. One, I know that the joint rules provide for a couple of mechanisms to file an amendment on a bill in a meeting that's conducted virtually. Have you supplied the text of your amendment to LCO? Is that something that we could see? Just make sure that members are clear about what the amendment is.
The clerk does have a copy of the amendment. And
I'll turn this over to LCO. Is there do you have the information about the rules that apply to virtual meetings, and the information that you would need from? Could you just? I guess this is a question for LCO. Just refresh members on the protocol for amending bills currently.
If we could stand at ease for a moment, I'll get that information for you.
Thank you.
Yep, for sure. And if everyone just looks in their email, Alex has sent out the amendment as well.
Madam Chair, well, I have some questions about the substance of the amendment. And so while I'd like to get clarity on the process, maybe while the LCO is looking that up, I could ask.
That sounds great.
Amendment some
Please
questions.
continue.
Yeah, so I notice that the amendment as drafted requires the hospital to notify the parents and or legal guardians of the child about the law. Now, it seems possible that while the mother will almost certainly be in the hospital, based on my understanding of basic biology, the legal guardians may not, another parent may not. How would the hospital be able to comply with this law if the other folks mentioned in your amendment are not present?
I mean, I guess that would vary depending on the situation, but let's say if it's a legal guardian, I mean, they're not going to let the child go to somebody who's not the parent or legal guardian, in addition to, you know, getting the information, but it's not later than the time that the child's actually discharged from the hospital.
But let's say the
person's still in there. Sorry.
I'm sorry, I apologize. I didn't mean to speak over you, Representative.
Yeah, but it does say there is no and though. It does say or legal guardian. The parents or legal guardian.
But let's say during COVID, for example, hospitals imposed restriction limitations, and so it's entirely possible. I understand it frequently happens that the father of a child may not be present at the birth. And how would the hospital go about tracking down the father to provide them this information?
Well, now you bring up a good scenario, because let's say, like what happened with me, I gave birth, but then my child didn't go on my insurance. My child actually went under my husband's insurance. But me getting that information, knowing that I wanted to make sure that I wasn't stuck with a bill, I gave the notice, and it reminded me that, oh yeah, I have to take care of that. So, just like the other things that were given, what the person does with it, that's, hey, it doesn't require me to sign up, right? It doesn't require me to actually do something, but it just reminds me that, hey, it's there. Don't forget. So
no, I guess I apologize. I may have been imprecise with my question. My question is a little bit different. I understand why it's important that parents know about the law. I understand that that's important, but there's a separate question that I'm asking, which is, this is a mandate on hospitals. And so if we are going to require the hospital to track down parents and or legal guardians, they may not know who the parents are. They know who the patient is before them, but they may, hopefully, but they may not know who the father is. They may not know who legal guardians are who are not present in the hospital. And so my question is, how is a hospital going to possibly comply with this new mandate that you put on them if they don't have that information in hand? There's nothing in the language that you've proposed that would clarify that, unless I'm missing something. I just wanted to see if there was a clarification through you, Madam Chair.
Well, again, it does say parents or legal guardian, because, so again, I'm thinking if you give birth, like, they're going to know that, okay, like, you gave birth, and again, the child can't just be released without, you have to, which I found out, you give your child a name. Technically, they wouldn't let me go without doing that, and then without starting the birth certificate. So they're not going to let that child just walk or roll out of the hospital in a carriage without, let's say, I guess if they were adoptive parents, without the somebody being there, and again, assuming that the mother who just gave birth, you kind of know who that person is. I mean, I don't see how we're not figuring out who just gave birth to the kid. Like,
No, I'm agreeing with you, Representative, that through you, Madam Chair. I'm agreeing with you that the mother's identity seems pretty self-evident, but that, you know, the language of the amendment isn't just limited to notifying the mother, it's limited, it includes notifying parents and or guardians. And doing that seems like a much bigger undertaking and may not be feasible depending on who actually presents at the hospital. But, you know, going on, I see another issue, which is, you know, I don't want to get in a position where I'm explaining what it's like to give birth to someone who's actually done it. I have not done it. But, you know, I heard the representative say in introducing the amendment that you're quote out of it for a couple of days. And I hope that's the case for the vast majority of women who give birth. But, you know, it's my understanding that there can be major birth complications. People can be, sometimes die while giving birth. There are people who are, you know, suffer major medical complications and could be out of it for weeks and or months. And, you know, I think the intent of the bill isn't necessarily aimed at people who are out of it for a couple of days, but really focused on people who are suffering significant complications. And so my question is there anything in the amendment, because you didn't just add a notification requirement, you also struck the language that extends the existing window to enroll a child. Is there anything that would provide some relief to somebody who's, let's say, is in a medically induced coma for 60 days and is not able to sign their child up for health insurance? How would you address somebody who's in that situation, Representative? Through you, Madam Chair.
That's a good question. However, at that point, now, interestingly enough, I just actually had this situation with a client. So they do, at that point, appoint, it's, I want to say like it was a guardian. In this case, it was because and I think the person in this situation was conscious for the first day and then slipped into a state where she was unconscious, or at least not able to provide answers and make decisions. Let's say they were eventually going to, you know, discharge the baby. And at that point, there's basically a legal guardian that's assigned. So in this case, it was not the father of the child because they were not married, and she hadn't said at that point who the father was. So it ended up being the parents who were in the hospital and making those decisions and actually had to take the baby home. So at that point, that patient's parents were the legal guardians and had to make those decisions. So on behalf of the mother and for the child. So that's what would happen. And that person would essentially be the legal guardian. So it's an odd coincidence, but I did just deal with this situation a couple months ago. But thank you for the question.
Yeah, thank you, Representative. I don't mean to belabor the point. I would just say that, you know, I welcome an opportunity. I think it's a good point to talk about a notification requirement. If people don't know what the law is, that's a problem, and I would be willing to work with you on it. I am concerned that the amendment that you have drafted and presented to the committee doesn't quite answer some sort of basic questions I think we would want to ask about a notification requirement. You know, I mentioned just as one example how you would track down people who are not, you know, who are parents but are not present in the hospital, or how the hospital even knows who the parents or legal guardians are. So I think that that's an important question that we need to be answered. I also think, just in your answer to the last question, that there may be some significant problems with jettisoning the, you know, underlying portions of the bill, and that could leave parents paying a surprise bill. And then I would also just want to reference the question that my co-chair, Representative Wood, asked about, you know, confusion between fully insured and self-insured plans. This proposal only applies to fully insured plans, and so making sure that we're not inadvertently giving people misinformation about what rights they're entitled to, I think, is important as well. So for all of those reasons, I would urge members to reject the amendment. I think that, you know, in doing so, that you should not see that as a rejection of any kind of effort that, on my part at least, to support a notification to parents. I think that's important, but that the bill itself is important, and making sure we get that wording right is an important part as well. So with that, that concludes my questions. I just know that the LCO has his hand up, and I don't know if he has questions, an answer to my question about the amendment procedure.
Thank you, Senator. Connor, could you chime in on process?
Thank you, Representative Wood, and thank you all for your patience. Rule 5C2 does say that an oral amendment is allowed in a virtual setting. And I don't know if you've all seen already that the amendment was emailed around to the entire committee. But to answer your question, an oral amendment is proper.
Thank you very much. We will move on to Representative Nuccio.
Thank you, Madam Chair. I'm wondering if I can ask the proponent of the amendment if she would be willing to strike the word each, which I think would rectify the problem that Senator Lesser had, at least with that portion of the amendment. Through you, Madam Chair.
Thank you, Representative Pavlik.
All right. Yes, I would. I mean, procedurally, I don't know if I would have to withdraw it and then resubmit it. I mean, again, it's minor language that we can work on after, just like we're doing with many of these other bills. And I don't know if that was the good senator's point, because it does. I do have or legal guardians, and just to clarify, the baby's not leaving without a parent or without a legal guardian. They're not leaving that hospital until that's established. You know, due to incidents that have, I remember years ago, you know, the baby is on lockdown with, you know, on their ankle or wrist. So that way, you know, they can't be just taken out. So, you know, there's a lot of protection there. And you know, for that reason, until a guardian or parent's established, they're not leaving. And so, you know, I don't think not being able to identify a parent or legal guardian, it would not be an issue, because then the baby would not be leaving. So, but to answer your question again, you know, I think if we pass it as is, you know, that's such a minor change, then I would definitely make that one letter, one word change. But for now, I would, for the purpose of the point of the amendment, again, being somebody who has gone through childbirth and been in this situation, and I really think this would be helpful to parents or guardians who are in this situation.
Thank you. So to answer one of your questions, Chairwoman Wood, I see this as, first of all, I don't think a hospital would even have an indication whether or not this was a fully insured or ASO plan at the time of somebody giving birth. And I may be wrong. It's been a long time since I had a child, but I'm in the same boat as Ms. Pavlik D'Amato. I've had a few of those things. Your baby is pretty much de facto covered for a certain amount of time before you have to report. So 60 days to me is really a long time to report. But there are many forms that we have to fill out as a mom or even a guardian at that point. You cannot leave the hospital without filling out a birth certificate. There's so many things that you get that you have to fill out. You have to start all your paperwork. There's so many things that the hospital's already giving you at that point. And again, my youngest is 22 now, so it's been a while, but I'm pretty sure I got notice that said, make sure you put your child on your insurance plan. So maybe that's gone away in the time since I've had a child. I'm definitely supportive of this amendment because it's not, I don't see this as something that is burdensome for a hospital to put the form in front of you to remind you that, hey, you've got 60 days to make sure your child is registered, or even just a simple notification that says, please be sure to contact your insurance company to put your child on there. I don't think that that's outlandish. I think that something like that could happen, and it is regardless of the type of policy that you have. It's a simplified notice saying, along with your birth certificate, along with your testing, along with contact your pediatrician to let them know that their baby's coming, contact your insurance company. So I'm supportive of the amendment, and I hope that people see this as a logical amendment to put this on there. If we have to put a notification in front of a parent or a guardian at that point, I think this puts the onus back on the hospital there. And trust me, I have a nephew who was in a hospital for the majority of the first year of his life from complications. And there's a lot that's happening there. I absolutely understand that. I watched my brother and my sister-in-law go through it, but I can rest assured, I know for a fact, they were also talking about their insurance coverage and how all of these things were going to be paid for, how they were going to be billed for it, what specialists were in, what specialists were out, and everything else. Working with Hartford Hospital and CCMC. So these were all things that they were doing throughout the entire first 9 months of my nephew's life. So I think a notification would handle the issue here, and it would prompt people to be sure that they knew that they had to contact their provider to make sure that their child was covered. Thank you, Madam Chair.
Thank you, Representative Ruggiero. Representative Meskers.
So I can't speak in any format other than the witness to childbirth versus a participant with 3 children. So I'll defer to that extent on experiential background. I'm wondering within the amendments, I don't want to gum up our proceedings and suggestions with the amendments. Is there a role that the hospital should be playing? I humbly question the author of the amendment, whether there's a role with the hospitals in terms of at admission, whether they should endeavor to enroll under the existing health plan, or at birth, that whether the hospital processing department should have a role to play versus turning it over to the responsibility of the parents or just deeming it to happen. Because the hospital has to apply, I guess, against the mother on the insurance claim. But registering the live birth with either a power of attorney, a limited power of attorney, to be able to open up the insurance application on behalf of the parents or the guardian, so that the hospital, who's a record keeper on everything else, I don't think it's an undue burden to say, follow through and register. So, we're either giving notice to parents or allowing or suggesting that the hospital should take some responsibility before they release a patient, that they're comfortable that they've made steps to register the insurance or activate the insurance on behalf of the parents. And I don't know whether, that's out of order as an oral suggestion or whether we can make that part of a working consideration. The question is, do we want to bring this forward? We have an amendment in front of us. I don't know if mine is, at first, certainly it's not in due order because I don't know how coherent I was in the suggestion, but where do we want to go with that? And do we think there's a role for the hospital? And I'm open to you, Madam Chair, Senator Lesser, or the author of the amendment to opine on that suggestion. And certainly Representative Nuccio, who sits there on the insurance side for that. I mean, I think what we're trying to do is assure that there's coverage for the children. And the question is what's the best way to do that? And I'm frankly not the expert. So I'm open.
That's a great point. Thank you, Representative Meskers. I understand the intent of the amendment. I respect where the ranking member is coming from with this language. I would not be supporting the amendment, unfortunately, just because I have expressed my concerns on the underlying bill with Senator Lesser, and he and I have agreed to work on the bill going forward. And that is a path that I would like to be taking, but I will note that I do understand where you're coming from with this amendment, and I'd like to continue that discussion as we do work on the bill, which I would flag as a work in progress. Do we lose Representative Comey? Representative Pavlik Tomato.
Madam Chair, I really appreciate Representative Mesker's his suggestion, and I was in the hospital for about 5 days after I gave birth. So for me, even for the first day, really out of it, by the 5th day, I just wanted to get out of there. But at the same time, I think I would have felt more comfortable doing it in the hospital and getting some help from somebody who, when you go home, even from the doctor's office, it's just, I feel like you don't have the support and don't even know where to start a lot of times with some of our questions. And, I do appreciate these hospitals that really, try to schedule everything for you and get things done all in one place, because for me, it just, I end up going down different paths. And I think the hospital, and somebody there would probably be the best person to help, or at least get us in the right direction in contacting our own insurance company. And even if we weren't able to actually achieve it and get everything done, at least get it started down, going down that road. But I've had discussions with different, with the insurance company and with other individuals about just finding a solution to this. And, for all the mothers out there, I mean, even getting to your first appointment right after, it's difficult. It's difficult getting stuff done in that first, and they want you to go to an appointment in like the first 3 days. And, for single mothers, especially, you're trying to feed your kid every few hours, and it's a lot to do. And I can't imagine doing it alone. So then adding on trying to be on the phone and figure out everything for the insurance, to me, that is just a lot to deal with. And so any help that while in the hospital that they could give would be very helpful and appreciative, again, especially to those single mothers out there, because it is hard. So thank you for the suggestion, and thank you, Madam Chair, for your suggestion and words, and hopefully we can work on this. So thank you.
Thank you very much. Any further discussion on the amendment? On the amendment, any discussion? I will ask clerk to take a roll call vote on the amendment.
This is Amendment A for Senate Bill 377, LCO number 2823. Senator Lesser?
Senator Lesser, no.
Representative Wood?
Representative Wood is a no.
Senator Anwar?
Senator Anwar votes no.
Representative Comey?
Representative Comey votes no.
Senator Wong?
Wong votes yes.
Representative Pavlak D'Amato?
Pavlak D'Amato votes yes.
Senator Cabrera? Senator Maroney?
Senator Maroney votes no.
Representative Dathan?
Representative Dayton votes no.
Representative Delnicki?
Representative Delnicki votes yes.
Representative, you'll need your camera on, please.
I didn't realize that initially that I had it off. Now that I have it on, I vote definitely yes.
Thank you. Representative Farrar?
Representative Farrar votes no.
Representative Meskers? Representative Meskers? Representative Nuccio?
Representative Nuccio votes yes.
Representative Perillo? Representative Paletta?
Representative Paletta votes yes.
Representative Riley?
Representative Riley votes no.
Representative Rochelle? Representative Rochelle?
Representative Rochelle votes yes.
Thank you.
I'm sorry. Representative Rochelle votes no on that.
Okay. And Madam Chair, I'll take the tally.
Yeah.
One moment. Total voting 14, those voting yay 5, those voting nay 9. The amendment does not pass.
Any further discussion on the underlying bill SB 377, an act concerning health insurance coverage for newborns? Any further discussion? Clerk, please take the roll.
Senate Bill 377 to JF to the floor. Senator Lesser,
Senator Lesser, aye.
Representative Wood.
Yes.
Representative Wood is a yes.
This is gonna get real.
One more time, Representative.
Representative Wood is a yes.
Thank you.
I was gonna say.
Senator Anwar.
Senator Anwar votes. Senator Anwar votes yes.
Thank you. Representative Comey.
Representative Comey votes yes.
Senator Wong.
Wong votes yes.
One more time, Senator.
Wong votes yes.
Thank you. Representative Pavlik D'Amato.
Pavlik D'Amato votes no.
Senator Cabrera. Senator Maroney. Senator Maroney. Representative Dathan.
Representative Dathan votes yes.
Representative Delnicki.
Representative Delnicki votes yes.
Representative Farrar.
Representative Farrar votes yes.
Representative Meskers. Representative Meskers.
Sorry about that. I apologize to the committee for missing the amendment. I would have voted against the amendment, although I appreciate the effort there. I vote yes on the bill, under the understanding of obviously that we're going to be reviewing some of the language there to try to be more inclusive. But it's a yes. Representative Meskers votes yes.
Thank you. Representative Nuccio.
Representative Nuccio votes yes.
Representative Perillo. Representative Paletta.
Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Okay, number 7, SB 410. This is an act concerning pharmacy benefit managers and spread pricing. This is a bill to do a study regarding pharmacy benefit managers and the distribution of drug practices regarding spread pricing arrangements, rebates, transparency and accountability that the Department of Insurance would present to this committee January of 2023. Do I have a motion to JF to the floor?
Motion made.
Motion by Rep. Comey, seconded by Representative Meskers. Any discussion? Any discussion? Representative Meskers.
I think it's a very necessary bill. I'm in favor of the bill. We're going to go down a very big and interesting rabbit hole with pharmacy benefit managers and how they cut their prices. I would encourage all of us to not get distracted. I think we'll get some good information. Maybe we'll be able to trim at the sides of policy benefit managers. I think ultimately it's a question of pharmaceutical pricing in the United States versus overseas that will end up there. But I appreciate the effort here, and I think it's worthy of our study.
Thank you, Representative Meskers. Any further discussion? Any further discussion? Seeing none, clerk, please take the roll.
For Senate Bill 410, JF to the floor. Senator Lesser.
Senator Lesser, aye.
Representative Wood.
Representative Wood is a yes.
Senator Anwar.
Senator Anwar votes yes.
One more time, Senator.
Senator Anwar votes yes. One more time.
Thank you. Representative Comey.
Representative Comey votes yes.
Senator Wong.
Senator Huang votes yes.
Thank you. Representative Pavlik Tomato, Representative or Senator Cabrera, Senator Maroney, Representative Dathan,
Representative Dayton votes yes.
Representative Delnicki,
Representative Delnicki votes yes.
Representative Farrar,
Representative Farrar votes yes.
Representative Meskers,
Representative Meskers votes yes.
Representative Nuccio.
Representative Nuccio votes yes.
One more time, Representative.
Representative Nuccio votes yes.
Thank you. Representative Perillo, Representative Paletta,
Representative Paletta votes yes.
Representative Riley,
Representative Riley votes yes.
Representative Rochelle, thank you.
Did you call me?
Yes,
Representative
Representative
Rochelle
Rochelle.
votes yes.
Thank you.
My apologies, I'm in 2 votes right now.
Tomato votes yes.
Thank you, Representative.
Alex, did you get Representative Pavlik Tomato?
I did, yes.
Okay. We're going to move on to SB 412, an act prohibiting hospitals from charging facility fees for telehealth services. This would prohibit fees from being charged on or off campus. Do I have a motion to JF to the floor?
So moved, Senator Lesser.
Seconded.
Moved by Senator Lesser, seconded by Representative Meskers. Any discussion? Representative Pavlik Tomato.
Thank you, Madam Chair. If you could just go through this bill and discuss with us what the issue is and what this bill is seeking to fix. Thank you.
Sure, this bill is seeking to fix any facility charges being charged for offering telehealth services when being done at a hospital on the campus.
Okay, and I guess there were some questions. So the original telehealth bill covered providers, but not hospitals. Is that correct?
I don't know that answer off the top of my head. I will, is LCO available to chime in on that?
I believe the language adds in hospital is underlined, so I believe the hospital was not in previous statute, so I think it adds hospital.
All right, LCO. This bill amends the statute to add hospitals. This is not a JFS bill, though.
Yes. Okay. And so so the issue was that I know this committee's looked at, if we could just explain, I guess when a patient sometimes would get a bill from a doctor and then from a hospital.
Correct. So when there's a virtual service being offered, this is to prevent a facility charge. So you're paying for the service, which is performed virtually. There should not be a charge for use of a room or a building, applied on top of that. So this is to prevent that from happening going forward.
Okay. I know in testimony previous bills and previous discussions we've had that hospitals, doctors did testify and inform us that, just because they're moving to telehealth doesn't mean that they don't have costs associated with now providing that service, as they're still in the building. They still have insurance, coverage for their employees and for their property insurance and electricity, all that they still have to pay. However, I think the concern here was that I guess what people consider kind of like almost a double charge considering it was telehealth. So I just wanted to just go over or voice my support for this bill, and I think it's a good bill and ought to pass. So thank you.
Thank you, Representative Pavlik-Tomato. Representative Meskers.
Yeah, I think it's important that we move forward in modernizing our healthcare system with telehealth. I think one of the ultimate impacts is going to be doing out of hospital practices, is that you're going to find it very much like office work at some level, that the number of doctors and facilities versus outpatient consulting from non-hospital locations, you'll be able to reduce costs and improve the overall service to the patients. I think what we heard in testimony were the two concerns about hospital assessing the fees and potentially telehealth being supplemental and increasing fees. So I think both of those, if we keep our eye on it, we can get better healthcare practice, reduce costs, and actually our constituents some relief in their healthcare costs through reduction in premiums by allowing this to go forward. So I would very heartily support this. And I thank the committee and the chairs for bringing it forward.
Any further discussion? Any further discussion? Seeing none, clerk, please take the roll.
Senate Bill 412 to JF to the floor. Senator Lesser.
Senator Lesser, aye.
Representative Wood.
Representative Wood is a yes.
Senator Anwar. Representative Comey.
Representative Comey votes yes.
Senator Wong.
Senator Huang votes yes.
Representative Pavlik-Tomato.
Pavlik-Tomato votes yes.
Senator Cabrera. Senator Maroney. Representative Dayton.
Representative Dayton votes yes.
Representative Delnicki.
Representative Delnicki votes yes.
Representative Farrar.
Representative Farrar votes yes.
Representative Meskers.
Representative Meskers votes yes.
Representative Nuccio. Representative Perillo.
Representative Nuccio votes yes. Sorry.
Thank you. Representative Paletta.
Representative Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
One more time, Representative.
Representative Riley votes yes.
Thank you. Representative Rochelle.
Representative Rochelle votes yes.
Once more for the camera.
Representative Rochelle votes yes.
Great, thank you.
Would anyone be opposed to a recess till 2:20, which is 12 minutes for just a quick mental and physical health break? 2:20, that's 12 minutes. Anyone opposed? Okay, we will recess until 2:20. We will start right at 2:20. Thank you. Welcome back, everyone. Okay. Oh gosh, I forgot my water. Next bill we have SB 413, an act concerning common interest ownership communities. This bill is a study bill that is looking to make sure that common interest ownership communities have reserves so that there's not deferred maintenance to particular properties. Do we have a JF to the floor? Do we have a motion for a JF to the floor?
I'll make a motion to JF to the floor.
Motion by
Representative Comey. Yeah.
Second.
Second by Representative Pavlock D'Amato. Any discussion? Yes, Representative Pavlock D'Amato.
I'm sure maybe if you could just briefly, I know this is a study, but just maybe explain for members of the public what a community interest property is.
Sure, this is like a
common
condo.
interest ownership.
Yeah, this would be like a condo association in a tall building, a multi-unit building. And this is to make sure that these properties are not deferring maintenance that would make the property unstable and in the worst case collapse like it did in a case in Florida. It is just to make sure that these condo associations and other common interest ownership communities are doing their proper due diligence to the properties that they have an ownership stake in. And that study would be provided to our committee.
Thank you very much.
Any other discussion? Any other discussion? Seeing none, clerk, please take the roll.
For Senate Bill 413 to JF to the floor, Senator Lesser.
Senator Lesser, aye.
Representative Wood.
Representative Wood is a yes.
Senator Anwar.
Perfect timing. I just parked. Senator Anwar votes yes.
Representative Comey.
Representative Comey votes yes.
Senator Wong. Representative Pavlock D'Amato.
D'Amato votes yes.
Representative Cabrera. Senator Maroney. Representative Dathan.
Representative Dathan votes yes.
Representative Delnicki. Representative Farrar.
Representative Farrar votes yes.
Representative Meskers.
Representative Meskers votes yes.
Thank you. Representative Nuccio. Representative Perillo. Representative Paletta. Representative Riley.
Representative Riley votes yes.
Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Great. Thank you. Next up, we have, do we have a motion to start a consent calendar?
So moved.
So moved. Representative Dathan, second.
Second.
Moved by Representative Dathan, second by Representative Pavlock D'Amato. First on the consent would be SB 414. Second is SB 416. Third is HB 5387.
Madam Chair?
Yeah.
Correct me if I'm wrong, and LCO can certainly pipe in. My understanding is that the best way of doing this would be to have a motion to JF or JFS each of these bills and seconded, and then after those are on the floor, then we would add that to the consent calendar without objection. So I think that would be the way, you know, and I would refer to LCO if that's not the correct protocol, but I think that that's probably the best way.
Yep.
in like a
Please,
consent.
please let me know the best way to do this. Anyone? Why don't we take your advice and we will do that? Is there a motion to add SB 414, an act concerning mental health parity, as a JF to the floor on consent?
Representative
So
Farrar.
moved. Second by Representative Dathan.
Second by Representative Farrar. Do we have
And then
discussion?
I think it's, oh, Lucy, Representative Dathan did.
And then do I just keep adding to the consent at this point?
So I think I then make a motion to add this bill to the consent calendar.
I don't, Madam Chair, I don't believe you need a motion. I think you can place it on a consent calendar and hearing no objection. So I think you can.
Okay.
So I think you could say, you know, I think we, and again, I would defer to LCO if there's any contrary legal advice.
Connor at LCO, that's my understanding as well.
Okay, so we have moved SB 414 to the consent calendar. Correct?
Yeah, I think you would say, Madam Chair, I think you'd say, you know, you'd like to place something on the consent calendar, then open it up for anybody to object. And if there's no objection, then you could place it on the consent calendar and then move to the next item.
All right, any objection to placing SB 414 on the consent calendar? Seeing no objection. Do we have a motion to place SB 416, an act promoting competition and contracts between health carriers and healthcare providers, on the consent calendar?
Madam Chair, I'd like to make a motion to JF SB 416 to the floor.
Do we have a second?
Representative Comey seconds that.
A motion from Senator Lesser, second by Representative Comey. Any issue placing this on the consent calendar? Sorry, I would like to apologize to everyone. I'm sorry. Okay, next we have HB 5387, an act concerning continuing education requirements for public adjusters. Do we have a motion to JF this to the floor?
Madam Chair, motion to JF that to the floor.
Do we have a second?
I'll second it.
Second by Representative Meskers. Any issue placing this on the consent calendar? Seeing none, we will go on to HB 5389, an act concerning insurance. Do we have a motion to JF this to the floor?
Madam Chair, motion to JF House Bill 5389 to the floor.
Made by Senator Lesser. Do we have a second? Do we have a second?
Second, Representative Farrar, second.
Second by Representative Farrar. We'd like to put this on the consent calendar. Any issue with moving that to consent? Seeing none, we will place that on consent calendar. HB 5400, an act concerning the regulation of insurance in the state. Do we have a motion to JF this to the floor?
Madam Chair, motion to JF that House Bill 5400 to the floor.
Made by Senator Lesser. Do we have a second?
Second.
Second by Representative Rochelle. And any issue moving this to the consent calendar? Seeing none, we will move on to number 17, HB 5409, an act concerning financial planners in the Connecticut Unfair Insurance Practices Act. Do we have a motion to JF this to the floor?
Madam Chair, I'd like to make a motion to JF House Bill 5409 to the floor.
Made by Senator Lesser. Do we have a second?
Seconded.
Seconded by Representative Meskers. Any issue placing this on consent calendar? Seeing none, we'll move on to HB 5411, an act concerning travel insurance. Do we have a motion to JF this bill to the floor?
Madam Chair, I'd like to make a motion to JF House Bill 5411 to the floor.
Made by Senator Lesser. Do we have a second?
I'll second.
seconded by Representative Meskers. Any issue placing HB 5411 onto consent? Seeing none, we will move on to HB 5447, an act concerning prior authorization for healthcare provider services. Do we have a motion to JF this to the floor?
Madam Chair, I'd like to make a motion to JF HB 5447 to the floor.
By Senator Lesser, do we have a second? Second by Representative Pavlik Tomato. Any issue placing 5447 onto the consent calendar? Seeing none, we will move on to HB 5448, an act concerning employment practices liability insurance policies. Do we have a motion to JF this to the floor?
Madam Chair, I'd like to make a motion to JF HB 5448 to the floor.
Motion made by Senator Lesser. Do we have a second? Second. Second by Representative Pavlik Tomato. Any concern placing 5448 onto the consent calendar? Seeing none, do we vote on the consent calendar now or at the end?
Madam Chair, I think there's one more item.
Oh, sorry. Thank you. HB 5449, an act concerning certificates of need. Do we have a motion to JFS this to the floor?
Madam Chair, I'd like to make a motion to JFS House Bill 5449 to the floor.
Second.
By Senator Lesser, seconded by Representative Dathan. Any issue putting 5449 onto the consent calendar? Seeing none, our consent calendar has been made. Any discussion? Representative Comey.
Yes, I was wondering if we intentionally left off the epinephrine bill.
Yes, HB 5386 and HB 5388 were intentionally left off of the consent calendar.
Very good. I just wanted to make sure. I didn't know if to make sure. Thank you.
Thank you, Representative Comey. Any other discussion? So I believe the motion on the floor is to vote on the consent calendar. And clerk, please take the roll. Did I mess up? Sorry. Representative Pavlik Tomato.
I was just wondering if you could just go through the numbers of the bills on the consent calendar one more time.
Clerk, could you please go over the numbers and the bills that are on consent?
For consent calendar A, we have Senate Bill 416, 414, House Bill 5387, 5389, 5400, 5409, 5411, 5447, 5448, 5449.
Thank you.
Any further questions? Clerk, please take the roll.
For consent calendar A, motion to JF and JFS. Senator Lesser,
Senator Lesser in the affirmative.
Representative Wood,
Representative Wood is a yes.
Senator Anwar, Representative Comey.
Representative Comey votes yes.
One more time, Representative.
Representative Comey votes yes.
Thank you. Senator Wong,
Senator Huang votes yes.
Representative Pavlik Tomato,
Pavlik Tomato votes yes.
Senator Cabrera, Senator Maroney, Representative Dathan,
Representative Dathan votes yes.
Representative Delnicki,
Representative Delnicki votes yes.
Representative Farrar,
Representative Farrar votes yes.
Representative Meskers,
Representative Meskers votes yes.
Representative Nuccio, Representative Perillo.
Hold on. Rep. Nucio votes yes.
Sorry, how do you vote, Representative?
Representative Nucio votes yes.
Thank you. Representative Perillo, Representative Paletta, Representative
Put the
Riley.
vegetables in? Thank you, great. I'll just finally put it on there.
Representative Riley votes yes.
Representative Rochelle,
Representative Rochelle votes yes.
thank you.
Thank you, everyone. Next, we have HB 5386, an act concerning health insurance coverage for epinephrine cartridge injectors. Do we have a motion to JFS to the floor?
So moved, Senator Lesser.
Moved by Senator Lesser. Do we have a second?
Second, Representative
Combs.
Second by Representative Dathan. Any discussion? Representative Pavlik D'Amato.
Thank you, Madam Chair. If you could just go over this bill briefly and tell us what it does and what it changes overall, and then also especially in regard to co-pays. Thank you.
Sure, absolutely. I am going to pass over the discussion to Representative Comey, who has been working for 2 years on this bill with a great working group. And she's just been put a ton of effort in. So Representative Comey, would you mind answering the questions on the changes to this bill?
I would be happy to. Thank you, Chairwoman, and thank you, Representative Pavlik D'Amato. So this bill, as you remember, we passed out of the House last year, and it did not get picked up in the Senate. So we have, and it came about through, as Representative Wood said, through a working group that we put together with, it was actually bipartisan, with Representative Nuccio and also with the insurance companies and other players that had an interest in this. And what this bill does is 2 parts to the bill. The first is to, much like our insulin bill in other years, it has a $25 cap on co-pays for any epinephrine auto injector. So that would mean maybe a name brand or also a generic brand. So that would be important to know. And these are, like I said, on fully insured policies that the state of Connecticut has authority over. And so that's the first part of the bill. And then the second part of the bill is having the insurance companies be able to, and on insurance policies that when folks go to get their prescription filled, that the insurance companies, that the pharmaceutical plans have an epinephrine auto injector on their lowest tier that they offer their insured. So those are the 2 parts of the bill. There was a third part of the bill that held up the bill last year and to pass further. So, this epinephrine is a life-saving medication for so many of our family members and ourselves and our children. You need multiple auto injectors. You need them at school, you need them at home, you need them at aftercare programs. And often your insurance does not pay for multiple injectors. And by the way, they also expire after 1 year. So there are multiple sort of schemes in how we get as families with food allergic kids and families who need epinephrine, that we go to jump through hoops to find copay assistance and coupons and all sorts of tricks to work around it, which often uncover all kinds of other issues, such as supply issues with manufacturers. And we are excited about this bill and want to get it over the finish line this year. And I would love your support.
Thank you, Representative. Do you have any additional questions?
Just a couple comments. I'm overall glad that the working group came together. Thank you for all your work on that. I, of course, do have concerns about mandates and then increasing costs for that 30% of the market that we discussed, and about the study that we're doing and how that would be impacted. I am supportive, in general of the concept, but I will be voting no today just to flag it. But I do want to again thank you for all your hard work.
Thank you, Representative Pavlik-D'Amato. And I will just say that, like the insulin bill that we passed 2 years ago, it has been found that there has not been a very large impact at all. It's been a very nominal impact, if at all, over the cost on our premiums. So I'm hopeful that that is the same case for this epinephrine. Thank you.
Thank you. Any further discussion on this bill? Any further discussion? Seeing none, clerk, please take the roll.
For House Bill 5386 to JFS to the floor, Senator Lesser.
Senator Lesser, aye.
Representative Wood.
Representative Wood is a yes.
Senator Anwar. Representative Comey.
Representative Comey is a yes. Thank you.
Senator Wong.
Senator Huang is a yes.
Representative Pavlik-D'Amato.
Otto votes no.
Senator Cabrera. Senator Maroney. Representative Dathan.
Representative Dathan votes yes.
Representative Delnicki.
Representative Delnicki votes yes.
Representative Farrar.
Representative Farrar votes yes.
Representative Meskers.
Representative Meskers votes yes.
Representative Nuccio.
On and off. Representative Nuccio votes yes.
Representative Perillo. Representative Paletta. Representative Riley.
Representative Riley votes yes.
And Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Next bill we have is HB 5388, an act concerning the insurance department's recommendations regarding value-added products or services and prohibited insurance practices. This was tabled at our last Insurance and Real Estate Committee meeting. It is a bill proposed by the Department of Insurance. Do I have a motion to JF this to the floor?
Madam Chair, so moved.
Moved by Senator Lesser. Do we have a second? Do we have a second?
Second.
Seconded by Representative Rochelle. Any discussion? Senator Lesser.
Thank you, Madam Chair. As I mentioned in the last meeting, I believe this has been an ongoing conversation between a variety of stakeholders. I just want to thank the Insurance Department for working with the committee and encourage them to continue the dialogue moving forward to address any outstanding concerns. And I would just speak on the Senate side for my willingness to continue to have those conversations with folks in the provider community who do have concerns about some of the unintended consequences of this legislation. But as I mentioned at the last meeting, this bill conforms to current practice, and it's my hope that we can reach a meeting of the minds about the legislation going forward. And with that, Madam Chair, I will be supporting the legislation today.
Thank you, Senator Lesser. Senator Wong.
Thank you, Madam Chair. And as I mentioned in our previous public hearing engagement or a past vote, I will be voting no on this because I still do have some concerns of unintended consequences. I want to acknowledge the good work by the Insurance Department and the Commissioner himself, who I respect greatly in his reassurances, but I am just concerned about the marketplace unintended consequences of this. And I don't see a pressing, urgent need for this bill to the marketplace. So, and I hope that this time I will have more than one no vote to support that concern. So I'll be voting no to raise more concern on it. But as the good chair cited earlier, I'm always happy and willing to work to address these concerns and to counter any unintended consequences on this matter. Thank you, Madam Chair.
Thank you, Senator. Any further questions or comments? Seeing none, clerk, please take the roll.
For House Bill 5388 to JF to the floor, Senator Lesser,
Senator Lesser, aye.
Representative Wood,
Representative Wood is a yes.
Senator Anwar, Representative Comey,
Representative Comey votes yes.
Senator Wong,
Senator Wong votes no.
thank you. Representative Pavlik D'Amato,
Pavlik D'Amato votes yes.
Senator Cabrera, Senator Maroney, Representative Dathan, Representative Delnicki.
Representative Delnicki votes yes.
I'm sorry, can you repeat that?
Representative Delnicki votes yes.
Thank you. Representative Farrar,
Representative Farrar votes yes.
Representative Meskers,
Representative Meskers votes yes.
Representative Nuccio,
Representative Nuccio votes yes.
Representative Perillo, Representative Paletta,
Representative Paletta votes yes.
Representative Riley.
Representative Riley votes yes.
Thank you. And Representative Rochelle.
Representative Rochelle votes yes.
Thank you.
Thank you. I want to just ask the clerk, are there any bills on the agenda that were not referenced?
It looks like we've taken action on all agenda items.
Thank you, Senator Lesser.
All right, no, Madam Chair, I just wanted to, if it's possible, speak on the next item of business, the date and time of the next meeting, if that's appropriate. But I will defer to you.
Okay, the next agenda item is the announcement of the time and date of the next meeting. Number 4, Senator Lesser.
Yes, thank you, Madam Chair. Madam Chair, it's my understanding that this is our last, our only scheduled meeting of the week, and I think members should. Oh, I apologize, Madam Chair. I think before we do that, before we proceed to item number 4, we should probably announce that if there's a time that votes are being held open to. I don't know if 4 is a good time.
Held open until 4 p.m.
Okay, great. Thank you, Madam Chair. I apologize for skipping that. No, at this point, it's my understanding that this is our only scheduled meeting at this point. I've heard from members' interest in potentially acting on 9 additional items, which could be on our JF meeting on Thursday. But at this point, there are no meetings scheduled. So I would just open that possibility and express interest in that if there is a consensus. But acknowledge that at this point we have no additional plans for a further meeting. So with that, I want to thank you, Madam Chair, for a very heavy meeting today and getting a lot done, and want to thank the members for their patience and cooperation as we got a lot of business done today. So thank you very much.
Thank you, everyone. I appreciate your time, and we will not adjourn at this time because we will keep the votes open until 4 p.m. So I would ask the ranking to share that with your members who are not here, and we will see you soon. Thank you.
Madam Chair.
Yes, Tony? Sorry,
Yes.
Senator
Madam
Walker.
Chair, if I may, given this might be our last committee meeting, I just wanted to take a moment to acknowledge the the efforts of the chairwoman and the leaders in this committee, as well as our new clerk, Alex, who's done yeoman's work, as well as OLR and the LCO staff that make us look a lot smarter than we are. And I just didn't want to be remiss in not acknowledging their efforts and in the many hours that they put dealing with us. And so I wanted to say thank you to them. Thank you, Madam Chair.
Thank you, Senator. Have a great afternoon, everybody.
Hey, Alex.
Alex,
Can I vote?
when you're ready.
Yes, hi. I'm going to start with Representative Pleta, since he was on first. We'll make sure
Thanks.
that we get everybody's votes. One moment. Representative Pleta for Senate Bill 413.
Yes.
And on the consent calendar.
Yes.
And House Bill 5386.
Yes.
And that's it. You're all set.
Okay, thank you so much.
Yeah. Representative Nuccio.
Hello, Alex.
Hi, how are you?
Good, how are you?
Good. Let me check which bills.
I think I just missed one, but I'm not 100% sure.
No, but you know, but by the way.
I have Senate Bill 413.
I am a yes on that, please.
You can pick it up either.
Double check everything. All right, you're all set. Thank you.
Thank you, Alex. Have a good day.
You too.
Representative Dathan's here as well.
Great. Representative Dathan.
I think I just missed one vote.
No, there's one at the end.
Yeah.
For House Bill 5388.
Yes. That was a
I'm
straight
sorry,
JF.
you have your camera off.
Oh, apologies. That was a straight JF. Is that right?
Yes, that's correct.
I vote yes.
Okay. Let me just
And that's
triple check
everything.
everything.
Yeah.
Looks good.
Great. Thank you so much. Have
Yeah,
a good
thank you.
rest of your afternoon, Alex. Take care.
You too.
Bye-bye.
Representative Farrar.
Yeah. Thank you, Alex. I think it was the few in the beginning.
Yes. Senate Bill 355.
Yes, with the JFS, correct?
Yes. Senate Bill 357.
Yes.
Senate Bill 358.
Yes.
Senate Bill 363.
Yes.
And you should be all set.
Thank you, Alex. Really appreciate it.
Yeah, no problem. Have a good day.
Have a great rest of your day.
Hi, Representative Delnicki.
Question, Alex.
Yes. I'm missing a vote for Senate Bill 413.
Quick question. Did I miss any votes?
Yes, I'm missing a vote for you for 413.
I'm voting yes on that. And I gotta check one vote, and that was item 1.
Item 1 for Senate Bill 355.
Yes.
You voted negative.
I should have voted yes.
Okay, I will make that change. Okay.
All set?
Yep, all set. Have a good day.
Deal. You too.
Hey, Senator.
Hey, Alex, what votes did I miss?
We are missing Senate Bill 363.
I'm sorry, I can't hear you. I didn't hear you. Sorry.
Senate Bill 363.
Is that the podiatry?
Yes.
I'm a yes.
Senate Bill 364.
That's the dummy bill, right?
It's a placeholder bill, yes.
Or just not kind with that. Yes.
That might be it.
Okay.
Oh, here's another one. Senate Bill 413.
That's a study, yes.
Just double check the rest here. You are good.
Great. Thank you very much.
No problem. Have a good weekend, or
You
good
too. Bye.
afternoon, rather.
Hey, Alex, let me just get my screen straightened away here.
Sure. Okay, Representative, for Senate Bill 363.
Furloughs, yes.
Senate Bill 364.
Furloughs, yes.
Senate Bill 377.
Furloughs, yes.
Senate Bill 410.
Furloughs, yes.
Senate Bill 412.
Furloughs, yes.
Senate Bill 413.
Yes.
Then the consent calendar. Do you need all the bills?
I do. I'm good with all, yes.
Okay. Then we have House Bill 5386
Yes.
and House Bill 5388.
Yes.
All right, you're all set.
Thanks, Alex.
Yeah, thank you. Senator, how are you?
I'm well. How are you?
Doing all right.
Thanks for hanging out a bit.
No problem. So for Senate Bill 355,
Senator Cabrera votes yes.
Senate Bill 357,
Senator Cabrera votes yes.
Senate Bill 358,
Senator Cabrera votes yes.
Senate Bill 363,
Senator Cabrera votes yes.
Senate Bill 364,
Senator Cabrera votes yes.
Senate Bill 377,
Senator Cabrera votes yes.
Senate Bill 410,
Senator Cabrera votes yes.
Senate Bill 412,
Senator Cabrera votes yes.
Senate Bill 413,
Senator Cabrera votes yes.
the consent calendar,
Senator Cabrera votes yes.
House Bill 5386,
Senator Cabrera votes yes.
and House Bill 5388.
Senator Cabrera votes yes.
Thank you. You're all set.
Thank you. Appreciate you. Bye.
Bye. Hi, Senator.
Hi, sorry we had you wait. How are you?
Good. No trouble at all. I just have a couple of bills for you. Vote on Senate Bill 412.
Senator Anwar votes yes.
The consent calendar.
Senator Anwar votes yes.
House Bill 5386.
Can you remind me what that was?
An act concerning health insurance coverage for epinephrine cartridge injectors.
Senator Anwar votes yes.
And House Bill 5388.
Which one was that? Sorry about that.
No trouble. The act concerning insurance department's recommendations regarding value-added products on services and prohibited insurance practices.
Senator Anwar votes no.
All right, thank you.
That's it.
That's it.
Thank you so much. Thank you.
Yeah, have a good day. Hi, Senator.
Alex, how are you doing today?
Good, good.
That's good. Am I the last one or no?
Yes, last but not least.
Okay. Well, I was going to say, I'll just log off and log back on if I'm not the last, you know.
So we got a few bills for you, starting with Senate Bill 377.
Yeah, let me see. Okay, I voted on the amendment, but I didn't vote on the bill. Yes.
Okay. Senate Bill 410.
Yes.
Senate Bill 412.
Yes. Can you hold on 1 second?
Yep.
I'm following along just to check them off so I know I voted on them. All right, thanks, man.
Senate Bill 413.
Yes.
The consent calendar.
So was everything else on the consent calendar? So the consent calendar was at 414, 416, 53, and then all of the House bills, 5386, 53.
All the House bills except for 5386 and 5388.
5386 was not on. Okay, the EpiPen, value-added product. Oh, okay, that's right. That wouldn't have gone. Okay. Yes.
For the consent calendar?
Yes.
Okay. And for 5388?
Yes.
And 5386? I went out of order there.
Yes.
Great.
Yeah. What are you doing? You're trying to trick me, man. All right.
The
Thank you
test.
Yeah. Thank you very much, Alex. Have a nice day.
Thank you, Senator. You too.
Bye.